Hello, I'm Dr. May, and today I'd like to talk to you a little bit about root canals. A lot of times we hear about root canals and people panic about the pain and discomfort that goes along with it. And just want to make sure that people know today that there's no reason for any kind of dental procedure, especially a root canal, to ever hurt or even give you the slightest little bit of discomfort, especially not in this office. We have some very advanced anesthesia techniques now, and we just don't have problems with people feeling these procedures like they used to in the old days. I want to talk a little bit about the mechanics of a root canal. You may have been told you needed one, or you may have heard stories about one. Basically, when the inside of a tooth begins to die or is dead, it can become painful, symptomatic, it can become abscessed. And what we have to do is, to save the tooth, we have to go in and take the living or dead tissue, soft tissue, out of the inside of the tooth. And I'm going to use my schematic here to show you basically the steps of a root canal. So let me start that real quick. Here's a healthy tooth. You can see that this decay right here over time would cause the tooth to die. It begins to form a little abscess here. This abscess has gotten bigger. Well, to do a root canal on this tooth, we'd come in and we would open that tooth up. Obviously, being under anesthesia, we'd open this access up and we'd clean all of that infected tissue out. This is a specialized instrument called a file. We clean all of this out. We then put medication inside the tooth and let that medication sit while we work on the tooth. Used to, it took 2 appointments to do a root canal. Now we can typically do this process in 1 appointment. So once we get the tooth nice and cleaned out, we fill it with gutta percha material, then we build the inside of the tooth back up. Usually we'll place a crown on that tooth as well. Once we restore that tooth with the root canal buildup and the crown, typically that tooth is stronger than it ever was, and it should last a lifetime. So hopefully I've answered some questions about root canals today, and if you have any other questions, please call our office, 850-227-1123, and we'd be happy to answer them for you. Thank you.